Welcome back. This is Dr. Richard Farnham here with another Unscripted Surgical. Today we have our guest infectious disease specialist, Dr. Rhonda Fleming from University Medical Center. So welcome.
Thank you. Thank you for having me.
As an infectious disease specialist, what's the normal strategy? Where we are currently with the coronavirus, with the COVID-19, and why is this different from the last coronavirus, the SARS virus of 2003? Why has this been able to spread, and why has this gotten worse?
Okay, first, this is a new infectious process, an infectious disease, a viral infection with the coronavirus that the general population does not have any protected antibody. Nobody is immune to this infection process. Where are we now? There is, once we are facing an outbreak, an epidemic, now this is a pandemic. So the mainstays are diagnosing,
Okay.
isolation of the patient,
Okay.
trace of the contact, and then public health measures. And these are where everybody have to be cognizant and to participate in the public health measure. That means in the hand washing and covering if you have any respiratory symptoms, staying at home, avoid crowding, avoid travel if it is unnecessary. So all these public health measures that varies depending on the local where you are. It could be done by country, by state, by local, but all these public health measures has to be put in place in order to slow down the spread of the disease.
So right now we're kind of on this acceleration phase of the curve where every day more and more people are being diagnosed. And so for our part, as healthcare workers, we are on the front lines dealing with the condition, trying to contain it. Healthcare workers are giving their lives to do this.
Yeah.
This is, you know, a noble sacrifice that we're doing. We may see some repurposing of different healthcare positions. You know, there's a humorous meme going around about, you know, do you want your gynecologist intubating you or managing your vent? But the reality is there's going to be an enormous shortage of the availability of ventilatory support, ICU beds. There's estimated about 95,000 ICU beds in the country. I think we saw a graph here on this New York Times website where if we're able to take early measures and contain this virus, at its peak, we'll have a need for 265,000 beds, and there are only 95,000. So what happens then?
That's the importance of mitigation and slow this down. Because we cannot take care, the healthcare system will be exhausted just taking care of patients with coronavirus. Now, according to the natural evolution of this disease, we see that globally, 80% of the cases are just a cold or have mild symptoms that will not require hospitalization. But we are now close to 300,000 cases globally. And if 15% of the cases are critical, we are looking at these 15% that represent thousands of cases that will require mechanical ventilator. So we need to help slow down the this outbreak, epidemia, pandemia, in order to help our healthcare workers, to help our patients, to help our community, to better care for them.
And I think we can look to the world for either an example or a lesson, right? So if we look at China, they were able to impose draconian measures to limit all transportation and shut down the virus. If we look at the Singapore model, if we look at the South Korea model that you had talked about, where they were early on screening, implementing the measures, and we'll look at a graph, we'll put that up here for you, a graph that shows the number of cases on kind of the worldometer. And then we look at, so those would be an example, and then as a caution, we look at the Italian model, which in some parts they've had a higher mortality because they're the second oldest country, as far as age, the second oldest in the world behind Japan. But also they didn't take these measures early on.
Yeah, and it's important that identify the cases. One, we identify the cases and we could isolate, so then we could slow down, control the spread in the local community. So that is very important to follow the recommendation of the public health officials. Many people do not understand the process yet, and they are having a hard time to comply, but it's necessary.
So America is known to have this kind of rugged individualism that has kind of been, in some senses, the reason for some of our success on the world stage in business and in other enterprises. But at this time, this is going to prove more of a liability. We see footage of spring breakers going out, the millennials, the Gen Yers going out, choosing to have fun and do things. The problem with this is their idea is, well, the mortality isn't high. Even if I get it, I'll probably be fine. But they have to keep in mind that there are other people with that attitude, and one of those people is going to come into contact with their mother, their father, their grandparents, and this is actually going to affect the ultimate mortality. This could be millions of lives that are affected by what we can only characterize as reckless behavior right now.
Yes, there are both sides of the spectrum. We see those people that are saying, I belong to the 80% that is going to recover, I will continue going to my spring break, and I will not follow the strict regulation that they're imposing. And there are in the other side of the spectrum, people from the community that are really giving a hand, who are helping the elderly, who are helping with groceries. We have to be concerned. We have to care for the elderly. We have to care for our loved one and the immunocompromised. We don't have to be a physician. We don't have to be EMS. We don't have to be a law enforcement. We are all in to help mitigate this epidemic.
There's going to be plenty of time for finger pointing when this whole thing is over. But
when the whole thing is over,
we bungled the precautions early on. We didn't isolate. We didn't identify. We didn't isolate. We didn't trace. We're just getting scaling up the ability for testing now. And as we can look and see from the most current statistics, there are worldwide about 250,000 cases, and then in the United States alone, there are 20,000 cases, but the number's likely higher than that because we're testing more now.
Multiply by 2 or 3.
So right now, there are, well, if we can look at the consequences of action and the consequences of inaction from this, there's a statistical website, a graph that was generated by an epidemiologist that was published in the New York Times website. And we can see an example of what happens according to when we take action. And as we slide the graph to the right, lack of action as we get on into, July, we see the red curve showing the number of infections at peak, and then the blue curve ultimately the number of deaths that occur. And these are modifiable depending on how aggressive this virus ends up actually being. So on this spectrum, we take action now, mortality 355,000 ultimately, and over 1 million if we don't. So the time to take action is now.
Exactly. Well, it should have been yesterday.
So healthcare workers are out there, literally laying their lives down to try to get a handle on this epidemic. And I mean, everybody who has jobs that are essential to keep society functioning as we shelter down from this, the truck drivers, the custodians, responsible for stocking grocery shelves, keeping society functioning as we need to at a minimum, do those things. For everybody else, you got to stay at home. And we're not trivializing that. That's a sacrifice. It's going to be difficult. People are going to be out of work. People are going to lose jobs. But if we don't get in front of this thing now, there potentially won't be a society to get back to. So we are all obligated to do our part, right? Every single person. We're talking to everybody who's watching this. Yeah. You know, everybody who is performing their essential function. Everybody else that doesn't have an essential function, this is the first time in human history that you have a chance to save the world by staying in and watching Netflix. Don't travel. Stay at home except for essential activities. Stay home now. 20-second hand washing. So 2 happy birthday songs in a row, right? Social distancing. So this is very critical. So if you have to go out, the magic number, seems to be 6 feet.
6 feet.
To stay away. If you're sick, to prevent exposure to other people, you want to wear a mask. And even in your own home, you want to self-isolate from other members of your family.
Avoid crowding. Do not go to places where there are people gathering more than 10 people. Meetings could be done via teleconference. As a healthcare worker, we are doing telemedicine and telehealth as much as we can.
This is an attempt, after the virus has already broken any kind of containment, to flatten the curve. I mean, we keep talking about that, to try to minimize the number of people that are infected at one time. So right now, the measures are in place for 2 weeks so that we can actually catch up on testing.
Catch up on treatment, and caring for patients that really need to be in the hospital. Something important, that if you do have symptoms, probably you could have the coronavirus. But if you are not terribly sick, so you are not having shortness of breath, respiratory distress, you'll better care for at home. There will be chances that you could go and be tested. So you take appropriate precautions. But anyway, you have to be at home. We see in the hospital the patients that really need to be seen. We don't want also to expose other patients in the hospital that need acute care to the coronavirus. So, so if you are not terribly sick, you better be home. Now that the testing is going to be more available in the few days, so then there will be more chance for you to be tested, and you have to stay home in order to slow this down, so the healthcare workers, we could better care for the patients.
And there's a limited supply of personal protective equipment, and if people are doing unnecessary visits, if maybe they have a little bit of a fever, stay home, recover at home. Every visit that is unnecessary to the ER is a set of equipment that will be needed when this peaks for patients that are acutely ill on a ventilator that won't be available at that time.
Yeah, we are in need of personal protective equipment, so we really need to use it in a very rational way, because we are going to be in need of more. Whatever we have, we need to use it with rationally.
And so, please work with your healthcare providers and understand if we're canceling surgeries that are elective, if we're postponing visits that are not emergent, if we're transitioning things to a digitized medium, televisits. So on the upside, to have a stroke of positivity here, I think that what I'm seeing out there is good, as you noted earlier. People helping other people, people posting positivity on the internet, not end of the world scenarios. Because I think if we do this, if we do our part, we will come out of this. And as a nod to human ingenuity, because we think about it, this is the first time in human history where we are all singularly united. This is Homo sapien versus Coronaviridae, right? Exactly. This is a war. This is a battle between these two species, and we will prevail. But let's talk briefly about some of the drugs, some of the vaccine trials that are currently undergoing, and what the long-term view of that would be.
There is a collaboration between the NIH and Moderna, which is a private lab, into the development of an experimental mRNA vaccine. It's called the nCoV-19 1273.
All right, so I really appreciate you coming out. We'll get a little elbow here. Okay, boom.
Thanks for being here.
So stay tuned for additional updates that we'll be putting up. Stay safe. If you have comments, put it in the section. You can hit the subscribe button, hit the like if you like the video, and stay tuned.
Okay, have a nice day.